Welcome back, viewers. Here is a post-op consult for a 6 months post-op Morton's neurectomy. This lady, she particularly wanted some pictures of her verruca, so I put them up on Instagram on the day of surgery, and she's come back for a 6-month consultation, which is when I normally see my patients back, be it anything other than skin, so soft tissue, hammer toe, bunion, anything bigger. So particularly wanted to capture some of that post-op chat, and then also I'm going to put it up at the end, some of the post-op pain scores. Right, I think we've got it. We've got it as a nice angle.
Yeah.
So we're going to do that anon, so that you can't see your face.
Yeah.
Yeah. Did you say OCD? So I saw my GP actually last week, and he says I've got OCD and ADHD. I said, what does that mean, Dr. Jeffers? He says it means you like things perfect, but only for 10 minutes at a time. Apparently it's the worst combination. Right. So this young lady, she is 6 months post neurectomy. Now, I was actually having a little bit of a chit-chat on the devil that is Facebook a couple of hours ago. So we were talking on Facebook on one of the professional groups about plantar incisions. So there's a real, that's not a great light. Let me just see if I can just give a little bit. Oh, hello.
I'm quite enjoying lying down here.
What have
you found?
A light. I'm just illuminating the situation.
It made a difference to your camera.
So the Facebook thread was saying, we were taught years and decades ago, if you cut underneath, you'll get horrendous plantar scars. And that certainly is a worry. And I'm kind of a rarity in the profession in that when I'm doing neuromas, I go in underneath. Yeah. So although you can't see this, I'm talking to YouTube at the moment, Chucky Egg. Although you can't really see it in the video, this skin is super healed and supple. So what we do when we do the incisions for neuroma is we go in between the metatarsal heads, which are there and there, go in between all the way up, and then I come all the way back down. It's one of my secrets for I think what I get is the good results, is I do a long plantar incision, which gets me back into normal tissue where the neuroma is here. And it's just a shame you can't, on the YouTube video, at least Chucky Egg, feel how lovely and supple that skin is. So we are 6 months post, so I saw you at 2 weeks change your dressing, 4 weeks stitches out. So then tell me how things went after I last saw you at week 4. How the last 5 months been?
Well, I felt quite a lot of pain at the start after all the anaesthetic wore off.
So immediately post-surgery.
So the 4 weeks after, I just took it quite steady.
Are you NHS or you're NHS patients?
I am NHS.
Yeah, so the private patients, they get the good drugs that stop them having any pain. So I'm sorry about that. Joking, of course. I'm not really.
That's fine. But I think something I did definitely notice was I kept fairly active. I didn't. When I say active, I was on my feet quite a lot. Yeah. But
you're not bedbound,
I wasn't bedbound. I did have quite regular rests, but I didn't sit for long periods until I had to go back to work. And on the very first day, I got quite a lot of ankle swelling.
Because that's the thing. You rest for a month and you do nothing, and then when you go back, it's a combination of you do more, and then so you're doing sort of. I'm going to do this with my hands, so I do this on the look. So you do more, and you've got no compression from the bandage. So everybody goes a bit backwards at sort of week 4.
Yeah, so I definitely did when I went to work, which was on week 6, because I took that extra 2 weeks. Which I'm very grateful that I did, because I think
that extra couple of weeks made all the difference.
That extra couple of weeks did make a difference to the healing after I've gone back to work.
The skin is so lovely where you've healed. We were just talking just before I started the camera rolling. There's a little bit of just where the very fine cutaneous nerves are. There's a little bit of paresthesia, a little bit of frilliness in there, but all that neuroma pain that was there has gone. So I'm super pleased with this. But the main aim of the video really was just to say, so I'm speaking quick now, I've had 4 cups of coffee this afternoon. It's been a busy one today. Coffee is the secret.
Is it?
How it comes. Right. So the main aim of the video is to say that a plantar scar can work nicely. So I will keep the books open for you for 6 months now. The wound will continue to settle up until about the 12-month state.
Yeah.
Very, very rare chance of a recurrence of the neuroma, what we call a stump neuroma.
Yeah.
But I'm really pleased with that. We're going to do some
great.
pain scores now if we can.
Yeah.
And then I'll say Happy Christmas.
Okay, that's great.
Thank you very much.
Yeah.
Okay, as promised, I do some pre and post-op pain scores. There are lots of different systems out there. This is the MOX FQ Manchester-Oxford Questionnaire, and so you give patients, it's based on 3 different domains, and it particularly captures pain, but also function, and also really how the patients feel about the foot. So it's got those 3 domains. So you take a pre-op pain score, and it really helps to clarify for me what a patient's symptomatology is. And then I typically do it at 6 months afterwards as well, and you can see from the left to the right just how much better, you can see it quite visually, how much better the outcome is. And it's all about what we call PROMs, patient reported outcome measures. It's not what I think that matters, it's what the patient thinks. So her pain and function and social interaction scores have reduced very well indeed. So she's very pleased with the outcome. As always, thanks for watching. Leave a comment.